Hello everybody, welcome to Summer's Melanie's Enchanted Vids. Today I wanted to do a video about mental health. So this week I'm going to be doing a video about self-injury. Next week I'm going to be doing a video about anxiety. Hopefully Melanie can be in that one. And then after that I think I'm going to try and do a video about BPD, which is borderline personality disorder. So, anyway, for self-injury, also known as NSSI, non-suicidal self-injury, there can be suicidal self-injury, but that's not really what we're going to talk about today. So, some possible signs are markings on the body, unexplained cuts or scars, frequent use of bandages, not the appropriate clothes for the season. So it's the middle of summer and you're wearing pants, long sleeve shirts. Sometimes you will do that. I've done it before too. But if you're wearing it like all the summer, that could be a sign. If they try and avoid the beach or pools or somewhere they have to wear a swimsuit, constant use of wristbands or bracelets, mention and discussion of friends who self-harm, and yeah, those are some possible signs. Now, what are some mental health issues or illnesses that self-harm can occur with? One of them is anxiety, there's depression, BPD, borderline personality disorder, eating disorders, usually bulimia, but it can be others, poor self-esteem or body esteem, issues with emotional regulation, history of abuse or trauma, and a tendency towards internalization of problems and self-blame. If you're having issues with emotional regulation, then CBT therapy, or I think there's also DBT therapy, can help a lot. What to do if you suspect someone you know is self-injuring? So you should make eye contact and speak in calm tones. Voice your concerns and the reason you have them. Don't characterize self-injury as bad or inappropriate and other negative terms. And these people can be in a really vulnerable state. So you need to don't make them, they might think they're crazy or weird, or they'll feel a lot of shame. So try and normalize it. It's not a good thing, but tell them that some people use it for a coping skill and stuff. Why do some people do this? Sorry, I just thought I heard somebody at my door. One, sometimes it helps them forget about the emotional pain they're feeling, because if it's physical pain, it helps them forget about the emotional pain because it'll be a distraction, it'll hurt. And in my opinion, in my experiences, if I fall down or if I get hurt, I really can't concentrate on anything else. I can't concentrate on making dinner, I can't concentrate on doing my homework. Really can't concentrate on anything except it's hurting, something's hurting. Another reason is to show people how bad or hurt you feel. So some teenagers or adults, children, have a hard time voicing how they're feeling on the inside. And so what they do is they can self-injure, whether it's burning themselves, cutting themselves, there's other things too. And it's so that maybe they won't be as careful with people not seeing it because they kind of want people to see it. Not because they're seeking attention, but because they need help and they don't know how to tell you that. Now, Another reason is they use it as a form of self-punishment. So with an eating disorder and bulimia, say they throw up but they're trying not to. As a punishment, they could self-harm. Or the other way around. If they're getting better with their bulimia and they don't throw up, then it could be a form of self-punishment, because as much as they're not doing it, they think that they're gonna gain more weight or they won't lose any. This is a question I've seen a lot of people ask online, and it's, will you be hospitalized for self-harm? Unless the cuts are like really, or even the burns, unless they're like infected or they're really, really, really deep, you should not be hospitalized. Although if you tell an adult and you're under the age of 18, whether it's a teacher, therapist, counselor, social worker, camp counselor, anyone, they're legally bound to tell your parents, I believe. Well, in some countries. In Canada, well, in London, and I'm pretty sure they're legally bound too. And yeah, so that's it for today. Next week, I'll be doing a video on anxiety. The week after that, hopefully BPD. Make sure you subscribe, give this video a thumbs up. If you want, you can share this with somebody in need. Say it's somebody who is self-harming, or somebody who knows somebody who's self-harming and maybe wants to understand this a bit more. They can check this video out. I hope this helped you guys and you guys learned something new, and have a good day.